As we think about this shift to platform, in essence, from point solutions to platforms, how do you really work with employers, their ecosystem partners, and the payers to really deliver a better experience? And so we truly feel that it's a win-win if we as an industry can work together and join forces to deliver a better experience. We can ultimately provide the great healthcare that everyone in this country deserves.
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 388. Today we have the Flava of the week about new research about aging in place from AARP and the Consumer Technology Association. How can the adoption of age tech change when we design with older adults in mind in the first place? And how can we better educate ourselves about this product category? I'll talk about that. Then we welcome Snezana Mahon, Chief Operating Officer at Transcarent, to shed light on the company's recently released new consumer insights about the cancer experience, matching benefit structures to support those journeys, and where employers fit into the equation. It's time for the awesomeness. Are you ready? Let's go.
Flava of the week.
There's great untapped opportunity for technology to be adopted to better meet the needs and preferences of older adults, helping them live well and age in place. That's according to a comprehensive new study from AARP and the Consumer Technology Association that was released during CES in Las Vegas on January 8th. The study, titled Empowering Independence with Technology Among Adults Age 50 Plus, combines the work of a quantitative study from CTA and qualitative research from AARP. The CTA's part of that study reveals that older adults are comfortable with tech and consider certain technologies, especially those related to personal health, to be useful as they seek to age in place. The findings also indicated an opportunity to repurpose or reimagine mainstream technologies as tools to help older adults remain independent and in their homes and communities. This is referring to the age tech category, which includes personal health technologies like medical alert devices, digital blood pressure monitors, electric or powered wheelchairs and scooters, indoor security cameras, and electronic pill dispensers and medication reminders. Now, I don't know about you, but sometimes I still get the feeling that we're just scratching the surface when it comes to consumer-facing health. At least that's the feeling I get as I go further down this rabbit hole of understanding aging in place and age tech. And maybe that's because I'm just not yet familiar enough with the solutions to know how well they're designed to meet those basic needs of older adults like convenience and ease of use. To that end, before we start expressing knee-jerk reactions that we commonly hear, like old people just don't use technology well, etc., maybe we can brainstorm for a moment on 3 insights that are buried in the report. This new research talks about sluggish adoption of age tech among older adults, stating that connected medical alert devices, the top technology considered to help with aging in place, are owned by only 3% of those 50 plus, and just 18% plan to purchase them in the future to help them age in place. But then it mentions these 3 insights. Many older adults are concerned about the costs of these devices, they're concerned about the risks of data security, and they don't feel like technology today is designed with their age in mind. I'll say that again, they don't feel like today's technology is designed with their age in mind. Crazy thing, right? Like with so many other consumer health offerings, if someone doesn't feel like it was designed for them and it doesn't meet their basic comfort level of security and value, their likelihood to use it's going to be pretty low. So maybe this is more than just older people don't use tech, in air quotes. Maybe it's a sign of what's possible if we design with the right age group in mind to begin with, because we're going to be hearing a lot more about age tech in the coming years. Let's get ready to spend more time exploring how to design for older adults and help them adopt solutions that can help them do what they really want, to age in place. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
All right, hey, let's get into the flow today. Please join me. My guest today is Snezana Mahon. She is the Chief Operating Officer at Transcarent. Hey, welcome to the Healthcare Wrap.
Hi, Jared. Thanks so much for having me.
What's something that most listeners might not know about you? And in fact, if you just want to share a brief background about who you are and what you do.
Yeah, absolutely. So as you said, I'm Snezana Mahon. I'm the Chief Operating Officer here at Transcarent. I started out my career actually as a retail pharmacist with Walgreens. I then transitioned into pharmacy benefit management and spent almost 15 years of my career with Express Scripts in a variety of different roles, from Medicare to product to clinical innovation. And about 3 years ago, I decided to make the jump into startup world, where I joined Glenn Tolman to help build Transcarent. So it's been an exciting journey over the last few years. And something that people might not know about me, I'm a mom of two. My kids play a lot of sports, club sports. And when I'm not working, you can find me either on the soccer field, the basketball field, or the volleyball court. So lots of sports in our household.
Super fun. Tell us a little bit more about Transcarent. A lot of our listeners are familiar to different degrees, but what's that central problem that Transcarent is trying to solve out there in healthcare?
Yeah. So Transcarent is the one place for health and care, and we truly make it easy to access high quality, affordable care. And we actually offer a health and care experience that actually puts people in charge. We give them the information they need to make better decisions. And so just to give you some examples of what that includes, the One Place for Health and Care provides members access to everyday care needs, such as texting with a physician within 60 seconds, having access to high quality surgeries with centers of excellence, whether it's local or traveling across the country to the highest quality providers. We give members access to complex care support services such as cancer care. Then we also provide comprehensive support for really important topics such as weight health and everything around weight health, whether it's your lifestyle support, GLP-1 medication management, bariatric surgery. And then finally, we also support members when it comes to accessing lowest cost medications, whether that's looking at pricing of a medication on insurance, cash coupon, as well as being able to have full pharmacy benefits delivered to their home. And we do all of this on a single platform, and we go fully at risk as an organization. And one other exciting thing that Transcarent is doing is, you might have seen earlier this spring, we launched Wayfinding, which is the industry's first member-facing application of generative AI in healthcare, which is completely unlike anything else you have seen in the market. And so if we were to think back to the transition to 25 plus years ago from flip phones to the iPhone, Wayfinding is making this type of a radical shift in terms of the difference in benefit navigation. And so when you look at this platform, it actually now combines benefit navigation, clinical guidance, and care delivery, all in a single to use experience and platform, where the member, which is the health consumer, is in charge of their care when and how they want it. And it's truly game changing. And so not just the generative AI technology that we're enabling, but we're also pairing that and coupling that for members with the human touch, where every single member has access to a dedicated health guide that is available all times a day, whether they want to chat with them, they want to send them a message in the app. And of course, also our virtual care providers are just a tap away. And so Transcarent is really available for our members 24/7, 365. And we believe that no company does this today the way that Transcarent is doing it, where we are putting employers, their employees, their families, and providers all on the same page to really work together and provide the highest level of care. And so some really exciting things happening at Transcarent. And then the only other thing I would just mention in how Transcarent is delivering this is we're investing quite a bit in the integration across the ecosystem. And so integration has never been more important than it is today when you think about combining virtual care, pharmacy care, physical care, mental health care, chronic disease management care, all into a singular platform. And we're doing it both with local providers. Transcarent has partnered with some of the top 10 leading health systems in the country that enable our national independent provider ecosystem, where we work with the providers by paying them on time or in advance with the greatest access to care. And it's a win-win for everyone. And we're also partnering not just with the providers of care, such as the health systems, but as well as innovative payers, health plans, both local, regional, national health services and health plan players, because we believe that as we think about the shift to platform, in essence, from point solutions to platforms, how do you really work with employers, their ecosystem partners, and the payers to really deliver a better experience? And so we truly feel that it's a win-win if we as an industry can work together and join forces to deliver a better experience. We can ultimately provide the great healthcare that everyone in this country deserves.
I love the thought of what drives integration in this case and other ways that Transcarent designs its services, because one of the themes of our podcast is using consumer insights and really just insights about how people utilize their healthcare to drive the actual service design. Are there other just insights that led to that realization that integration has to be this priority, or there are ways that you just have learned about how consumers utilize their care to understand that's the strategic priority, that's the direction for Transcarent to go?
Absolutely. What we have seen and learned really over the last 3.5 years in supporting members on our platform, and we support over 4.5 million members on our platform, is that if you make it easy for them to get to where they're going, which requires deep level integration, the more likely they are to come back and really utilize the services, be more educated on the services that the employers, and there's nothing more that employers today want in the country, which is to have their employees be engaged in their healthcare. And so we truly believe that if you make it easy for members to access care, information all in one place, and integrations and seamless integrations have never been more important than enabling that on a singular platform. And that's why we continue to invest in it.
That's great. Well, I think that will probably fuel this next question I have for you, because it has to do with some recent research that Transcarent just released. It's about new consumer insights into the cancer experience in particular. This survey, my understanding is it was called Understanding the Employee Experience with Cancer. Can you dive into that? Tell us some of the highlights and what that survey was all about.
Yes. So in late November this year, Transcarent released the new consumer survey. And the reason why we commissioned it was to truly shed light on the challenges that consumers and patients and the caregivers face when it comes to the cancer care continuum. And it continues to be, and we all know, cancer continues to be the top cost drivers for employers, both on the medical and the pharmacy benefit. And the survey ultimately focused on key issues such as screenings, diagnosis, treatment, workplace support, financial burden, and really understanding how each and every one of those barriers might have an impact to the overall cancer care journey and experience, and hopefully getting to remission in the cancer care journey that patients face today.
Fantastic. Any particular insights or data points that stuck out there?
Yeah, absolutely. So who participated in the survey? I'm sure you're wondering that. We had over 1,300 individuals, both including patients and caregivers, that responded to the survey. And some of the key findings that we saw was the following. First, screening and early detection. 21% of respondents said that they were not up to date on their cancer screenings. And younger individuals and healthcare workers reported more barriers to timely screenings. So that tells us that we definitely continue to have a screening problem. And thus, we continue to see cancers that are ultimately getting diagnosed at later stages versus earlier stages. Second, the diagnosis and treatment challenges. 52% of patients and their caregivers said that it was very difficult in obtaining a clear diagnosis, meaning the clear diagnosis the first time. 64% of respondents said that they actually sought a second opinion following their initial diagnosis. And 80% of patients said that they had to wait at least 2 weeks before starting a treatment. And 45% of patients said that they had to wait a month or longer. So it shows us that access to care is not as readily available. The diagnosis isn't necessarily always clear. And 60+% of members are definitely looking for a second opinion. The other interesting facts or insights that we got out of the survey was when it came to urgent care and ER care, almost 80%, 79% of respondents said that they had at least one urgent care visit, and over 74% said that they visited the ER at least once. And 44% of respondents stated that the cost of their cancer care debt was actually exceeding $10,000, where over 70% of all cancer members that responded had at least $5,000 or more in expensive out-of-pocket expenses that they had to incur. And it doesn't just end there. We also asked them some questions around workplace challenges. 68% of members felt comfortable sharing their diagnosis at work. So that was really good to see that employees and members feel comfortable sharing that information with their work. And 74% of caregivers believe that workplace support could improve with better manager training. And I think this is something that's uncharted territory when we think about how employers, HR benefits leaders are engaging in this new sort of spectrum of care. When you're dealing with a cancer care employee, how do you provide them support getting in and out of the workplace? And one of the key respondents was, hey, how do we equip managers with this topic as we continue to see such a high rise of cancer cases and how to deal with them, both from a work level, an emotional level, a physical level, et cetera. And the other interesting insight, too, that came out of the survey that 85% of patients and caregivers expressed high loyalty to employers who offer cancer care supportive benefits. So that was really important to see as well. And then finally, which is not surprising at all, is the social and emotional impact that 60% of patients and 67% of caregivers felt lost, confused, and completely unsupported during their cancer journey. And I think this is a statistic that all of us should pay close attention to, because many of us have been impacted by cancer in our personal life. We may know a friend, a neighbor, a family member who has had it. 60% of most individuals feel completely lost, confused, and unsupported. And I think this is our opportunity as an industry to do a lot more when it comes to this topic.
Yeah, I think I would double down on that. And that's such an important insight for us to share. In my case, I have a pretty good friend who has a very recent diagnosis. And so this was of particular interest to me. And it's a late stage diagnosis, right? So, unfortunately for them, they're having the opportunity to figure out a lot. I think it hit them pretty surprisingly. So that, that's not unique to me. That's just, the fact of how pervasive it is and how it impacts not just the life of those who are being impacted, but everyone around them, everyone who cares about them and things. And so that stat, I would agree, this how many feel lost, just utterly unsupported. And that I would guess that reflect, that feels differently for those who are around them, their care teams who are doing what they can to help support a cancer journey. And yet somebody may absolutely still feel that way because of the big impact of the disease itself. Right. So the emotional state that someone feels while they're going through it.
Totally agree. And a lot of work. And I think when you think about what this survey in summary sort of highlights for us is we as an industry have some key gaps. You just mentioned your friend, and sorry to hear about that. Preventative cancer care and education and timely screenings is so important. Getting these screenings and getting them out early. Most consumers have no idea that, hey, on your 40th birthday, your 45th birthday, there's guidelines on when you need to have colonoscopies and mammograms and other things. How do we get greater awareness into the community? Second, the clarity and the speed of diagnosis, as we just saw in the survey, highlights that many times the diagnosis was not clear or it was very challenging to get one, and it taking a month plus going from doctor appointment to doctor appointment. And so driving more of that accessibility to care is really important. I think we have all known that healthcare and financial burden of healthcare is the number one leading driver to bankruptcies. And so seeing $10,000+ of average out-of-pocket expenditures that cancer care patients are facing, how do they prepare for something like that? And what does that burden to not just them, but their family look like, and to the employer for that matter of fact as well, when you think about the cost impact? And then the last gap that I think this highlights is a re-emphasized focus on workforce and workplace policies that address the unique needs of cancer patients, everything from leave to PTO policies to reemergence to work policies to additional support and care teams. I mean, when you talk to some cancer patients, right, sometimes the little things that you don't even, think about, like where do you go get a wig? How do you support certain things around like food trains, organizing the community and an employer to help support those individuals? So these are some really important things for employers and benefit leaders to think about when it comes to cancer and some of the gaps that unfortunately consumers are facing today.
Are there any other ways we haven't mentioned yet that you think are important when we just think about what do these insights tell us? Like, what could we do about it? What are there some actions we could take? We mentioned again, preventive services. Are there other things that helps us keep in mind?
Yeah, I would say two things for employers. The one thing is, have you thought about enhancing your benefits when it comes to cancer care? And like you mentioned, not just the clinical care. Hey, do I cover the benefit? Do I have medications? Do I have, hospital support, et cetera? It's the navigation of cancer care. And it's to support everything from early detection to remission. And so that is the first thing, investing in the cancer care journey and the navigation and the support, not just for the employee, but the caregivers. Investing in manager training. Manager training is going to be critical, and workplace support program, as we have discussed, and then potentially consider looking at financial assistance and options for better support, whether that's additional financial subsidies when it comes to screenings or other elements that employers are able to offer. And then for policymakers, as we think about it, how do we advocate for policies that improve access to cancer screenings? It's never okay to hear that people are waiting multiple months to get into a provider. How do we help accelerate that? How do we reduce the barriers to the timely diagnosis? And how do we have the mechanisms where health plans and employers are able to offer this expanded coverage to not just the clinical care delivery, but to the navigation and the support, the financial, the emotional, the social support across the board. And I think we need to think about this longitudinally as an industry when it comes to the topic of cancer care.
What a perfect way to wrap up here. I want to give us a minute here right as we wrap up to say what gives you hope amidst all of this. Or pointing out identifying some gaps, as you mentioned. We also identified, I think, some things that can give us hope. What gives you hope just in general for healthcare in our country?
Yeah, I mean, as I hear from many of your guests, it's all about the consumer-centered, or as we call it, consumer-directed care experience that people really want. And we have a lot of work to do as an industry, but I feel like change is happening, and we're experiencing that change even for clinicians and individuals and consumers. When it comes to the power of technology, what gives me hope is that the technological advancements, the pharmacological advancements that we're seeing that I'm really excited about. And one in particular is generative AI. As I mentioned earlier with AI, even here at Transcarent, we're leveraging AI to help our virtual care providers from burning out. I mean, when you hear about what's the greatest burnout today for doctors, it's the administrative burden. And so how do we leverage technology to help enable providers to manage some of the administrative burden, the intake, the paperwork, the follow-up, the charting, so they can actually spend a quality time of diagnosing people, giving them the time to get the right diagnosis out of the gate and helping them get the care that they need. And so super excited about that. And ultimately, how do we think about AI delivering a better experience for members? So instead of members today having to search on Google, which is the most, search site for healthcare information, how do we actually personalize the experience for the consumer? And so here at Transcarent, our wayfinding experience is a simple way to get personalized answers on where do I get the care? What are the next steps? How do I access a provider? And so that's what gives me hope, is that the combination of the technology and the human sort of centered clinical care delivery, putting them together and putting the consumer in charge with all of that information is where we're going to drive change over the next 5 years.
Driving change. Love to hear that. It's been an absolute pleasure to speak with you about this consumer research that Transcarent is doing and specifically in the cancer experience side of things. Thanks so much for joining us today, giving us so much to think about.
Thanks so much for having me.